Dear ladies and gentlemen, welcome at this information session for our Master of Bioethics from the University of Leuven in Belgium. My name is Pascal Borry. I'm Program Director of our Master of Bioethics, and it's a pleasure to introduce to you the essentials of our Master of Bioethics. In my presentation, I will talk about the quintessential elements of our program, the typical characteristics of our Leuven approach, say something about the students that are in our program, the profiles of the candidates that apply, the career opportunities linked to a Master of Bioethics, say something about our program structure, and provide some practical information as well about our program. At the end, we will as well answer some of the questions that you might have, some of the questions that you asked beforehand. I invite you as well to ask some questions during this session, put them in the chat box, and we'll come back to them at the end of my talk. So first of all, our Master of Bioethics is a one-year program organized in Leuven. It's a Master in Advanced Studies. This means that in principle you need to have a master to enter our program or having a degree that is considered equivalent to a master degree. And if you have any query on that, you can always contact us. The program is fully in English, and the education that is being offered during the day. It's not an evening education program, and it accounts for 60 ECTS credits, which is the European Credit Transfer System that says something about the study load of a program. And the program is fully organized in Leuven in Belgium. Leuven is a nice city close to Brussels. It's a vivid student city with 40,000 students around in the city, and as well with 5,000 international students. So studying in Leuven means to become part of an international community and a vivid student community as well. That is really forms integral part of the city. The city is the campus. It's not a campus separated from the city, but city and university are one cohesive unit. So what is typical about the Leuven approach in the Master of Bioethics, and what is different about our Master of Bioethics compared to other programs? First of all, it's a program focused on bioethics as such. It's not focused on applied ethics, for example, with a little bit of attention to bioethics. This means that at all the level of different units, program units, course units that are integrated in the program, there is clearly a direct link to bioethical issues. It's an advanced program. This means that you need already a master degree to enter the program or equivalent, as I said beforehand. And I think that's very crucial because this means that different graduates already enter with some background knowledge from different fields into the program, make it very interdisciplinary, and people enter the program with already a maturity of a certain degree. We emphasize a lot the research component of the program. We have approximately 1/3 to half of the graduates that move on to a PhD after finishing our program. So it's really a preparation to a third cycle, to a PhD program. We have a very international audience, and I think I would just to emphasize that, just looking at the participants in our information session today, we welcome people from Sudan, from Turkey, Indonesia, Spain, Nepal, Tanzania, Ethiopia, Iran, Norway, Cameroon, Ecuador, United Kingdom, Greece, Canada, Peru, Bangladesh, India, United States, Italy, and of course Belgium as well. And I think that represents really the truly nature of our program. We have people coming from all parts of the world. Our alumni come from more than 70 different countries, and I think that's a very strong component of our program. This diversity is not only at the level of the international audience, as well at the level of the interdisciplinary background of the different graduates, and I will tell a bit more of that in a second. And of course, the education is very focused on small groups Approximately, we have yearly 20 students enrolled in the program, which allows for a lot of discussions and interactions between the group, and learning from each other is as well a very important component in the strategy of education. So our student population, and I think it's important to emphasize that we will celebrate in this academic year, or in 2020, in fact, the 20th anniversary of our program. We started in the academic year 2000-2001. And since then, more than 250 alumni from 70 different countries and nationalities entered into the program and finished their studies. We have this year 21 students enrolled in the program, last year 15, and that's I think that's approximately the size of the group every year. Our program is very interdisciplinary. 1/3 of the students enrolled in the program have a degree in medicine, or medical doctor. 1/3 roughly is coming from health sciences in its most general sense. Could be a master in health promotion, master of public health, master of biomedical sciences, master in pharmacy, biotechnology, and so on. And 1/3 is coming from humanities, philosophy, theology, law, psychology. So different program. I think this interdisciplinary mix is a very strong element in our program. So what are we looking at? I think people like you interested in value questions that arise in healthcare, public health, and biomedical research, willing to learn different research skills in order to do research in the field of bioethics, interested to analyze complex, controversial ethical debates and topics, want to develop a personal and coherent line of argumentation as well, knowing that a lot of these questions, there is not one final answer for once and for all. Motivated to work together with different people towards consensus, dialogue with each other in a multidisciplinary way, with attention for different cultural backgrounds. And I think these are the elements that are really core to be interested in our program. What are our graduates doing after the program? And I think there are different stories depending often about the motivation of people that enter the program. But what do we see from the program perspective? We see a lot of people continuing their activities in a clinical context. Graduates are active in research ethics committees, clinical ethics committees, are doing clinical ethics consultation. You have graduates involved in policy roles, for example, in national bioethics committees, as in the role of, for example, a secretary of those national bioethics committees, or in all kinds of advisory committees to ministers, so taking up really a policy role. A lot of graduates take up teaching roles. You have worldwide many different programs in health that have bioethics courses, and many of graduates are teaching bioethics, things about program in nursing, think about the programs in biotechnology, in medicine, audiology. All these different programs have courses in bioethics. A lot of graduates continue in research, taking up a fellowship as a researcher or starting in a research project at an academic institution. And we observe as well quite a lot of graduates that take up this program complementary to their first degree. For example, medical doctor that are as well interested to continue their medical practice, but are as well interested in broadening their perspective and finding ways to deal in a better way with ethical dilemmas they encounter in their day-by-day care. How is our program structured? So, as all programs in Europe, the standard program consists of 60 ECTS credits. We have chosen to build a program around I would argue some thematical areas and some skills, research skills oriented units, as well as some electives. So we have courses, for example, on public health ethics, on foundations of bioethics, on medical law, on ethics and law of biomedical research, on end-of-life issues, human genetics, and a course on clinical bioethics. That's a new course that will start from next academic year on. If you would look at the current curriculum, you wouldn't see that course. We wanted, and that's based on the feedback we received from students, we wanted to work more strongly on the clinical skills development, having more attention to deal with clinical cases, and we'll do that together with different clinical teachers as well for offering these classes in a very interactive and seminar type of teaching format. At the level of research, we have a seminar, interdisciplinary research in bioethics, that focuses on skills, how to develop a research plan, how to give a presentation, how to review a paper, publication ethics, academic writing, so different elements that are related to research skills. And of course, you have the development of a research manuscript that is important. I want to emphasize here as well, it's really the clear orientation to a publication. So we want that alumni really focus their research in a way that in the end they can publish their academic paper in an international peer-reviewed journal. At this moment, approximately 1 in 5 of our alumni is able, or of students is able to realize that. And we have as well the option of having electives from different programs. So, and many students really appreciate that, because it allows students that have very different backgrounds to develop a unique program that enables them to specialize in certain areas, very often linked to their research interests, very often linked to their interests that I would have at a professional level later on. And so we see that some students take more courses in philosophy because they feel sometimes a lack in philosophical background, but we have others taking courses more in methodology, for example, methods in qualitative research, methods in survey research, and would orient more in these skills. Some students are interested in theological perspectives and would take some courses from our Faculty of Theology. Some others are taking more courses in Faculty of Law, Sociology, or Medicine, or at the courses in languages, such as a course on academic writing. I think the wide range of courses is really appreciated as a quality element of our program, because it's really individualizing the tracks of the students. How is a program organized in Belgium? And I think it's important to realize that we start with the academic year in the 3rd week of September. We finish the first semester by the end of January, and start the semester again in the 2nd semester in February, ending in June, and having proclamation usually at the 1st week of July. We have periods of exams planned in January and in June, and for those that needs to redo some exams, those are planned in mid-August, 1st week of September. And I think I realized that for international students, those dates are really important to take in mind, because I realized that academic schedules differ from country to country. So this is really a very important calendar if you are interested in joining the program. So our program, and I think I would like to emphasize that, is only being possible by an important group of teachers involved in the program, and the core staff is coming from our Center for Biomedical Ethics and Law, which is a research institute with more than 20 researchers working on the ethical and legal aspects of healthcare and life sciences. I invite you to look at our website to see the different research interests of our staff, and to follow us as well on Facebook. This is our Facebook of our Master of Bioethics program, where we post a lot of vacancies, conferences, activities, and this is for alumni, but we want to offer that to all people interested in our program. Alumni are for us very important, and we try to connect with our alumni. I think we students, when students are around here, they have a very intense year with very close collaborations with staff. And we try every 5 years, more or less, to organize an alumni conference where we bring all alumni together. And here was a picture of the last alumni conference we organized in 2016. So those that are interested and want to know more about our program, I invite you to have a very concrete look at the schedule of the program, and because I know very much people are interested about, like, well, how does a week look like? And if you go to the website of giving an educational overview of our program, you will see there the button where you can click on schedule, and if you click, you would see here an overview of when the classes are being planned, and that helps to give you an idea how a week might look like if you are following the program. So the courses that are obligatory are, you can see them in the screen on a more darker color, and the electives are more a lighter version. So you will, of course, sometimes the electives can be on the same time, so sometimes you need to make a choice which elective you want to follow. It gives you, I think, a good overview how much hours you might have in a week and how you can build your curriculum. Tuition fee, I think we are one of the lowest, the program with the lowest tuition fees. This is 1,750, and we decide here not to make a distinction whether you are from the European Economic Area versus the non-European Economic Area. Tuition fee covers access to all courses as well as examination, support from the student services that are accessible to everyone, access to the social services, student employment office, the medical and psychotherapeutic centers, the student restaurants, student advice office, of course, the use of the library, some information technology infrastructure like our Blackboard system that we offer, as well an email system to which you have access. Admissions, so I emphasized this already beforehand. You need to be a holder of a master degree or equivalent. You need to develop a motivation letter. You need to show some proof of an academic excellence. You need to describe your interest in our program, express as well what you want to do with your program and how you think you might be a good fit to the program. We are examining as well your language skills. Having a good knowledge of English is crucial for the program, if otherwise the study progress would not be able to be made. So that's really important. Those that have proof of having done a program successfully in English don't have to provide that language certificate. But if you don't have that, you need to be able to showcase the results of a valid TOEFL test or EILTS test. So I don't want to go too much into detail. Our webpage of our university describing the admission and application process is quite clear. We ask, first of all, to fill in a short pre-registration. That's in order for at our level of the program to be able to quickly monitor as well that your intention to apply to our university, and then you can fill in the official online application form of the university that is being moderated completely by our international admission office. When your file is complete, and only when your file is completed, this will be sent to the program, and then the program will make an evaluation together with our colleagues of international admissions that will make all the communications to all the applicants. Applying in time is very important in order to make sure that all administrative requirements are being done in time. Like visa applications and so on. Here are some of the deadlines for applications for citizens from non-European Economic Area zone. This is the 1st of March. For citizens in Europe, the 1st of June. And if you have any questions on that, you can always contact us in order to follow that up. We have as well some fellowships opportunity, and I think that's we are really grateful that we have the fund Professor Roger Borgraaf, which was a fund that has been installed to provide people opportunities to study and excel in the field of bioethics. And we are currently using this fund to allow participants to enter in our Master of Bioethics program. This is being done by a small fellowship of 3,000 euros being paid in monthly installments. You need to apply before the 31st of March, and we will provide results of this application by April 2020. On our website, we have as well some links to fellowships that might be of interest to you, sometimes depending from the country where you are from. But those fellowships are external to us, so we don't really have any relationship, but we are always willing to offer letters of support or proofs that you have been accepted to our program if that's necessary to support your application. The Flemish government is offering now for a few years mastermind scholarships, and we really support any applications. We have had almost in the last 4 years, almost every year, successful candidate from our program that received a mastermind scholarship. So I really hope that in the future applicants will make use of that. But beware that the deadline for application is already the 1st of February, so you really need to hurry up in order to apply for that scholarship. So at the end, so why study bioethics in Leuven? I think from the program we are really confident that we are offering a high quality education with excellent researchers working in the field of bioethics, with a large staff being involved and committed to the program. By having students from different backgrounds, different countries, with the heavy involvement of the staff, we are really convinced that we offer a stimulating learning environment that I think for many alumni has made a difference in their professional careers. It's a multidisciplinary context, it's an international group, it's a curriculum with options for personal tracks, for personal interests. It helps you to develop as a researcher. It's an interesting tuition fee in an attractive city. So I think there are many reasons to study bioethics in Leuven. I really hope that you will be joining that community of alumni that have started and continued to study bioethics in Leuven. And we hope that you will join us. And please contact us for any questions that you might have on our program. You are most welcome to answer your questions. I'm always open as well to have individual discussions with interested applicants and to answer potential questions that you might have. So now it's time for questions, and so you can still add different questions in the chat if you would have. Meanwhile, I will answer already some of the questions that have been asked beforehand. So, looking at the questions that we have at this moment. So, some people are asking if someone is still studying at this moment and hasn't finished their master degree, is that a problem? No, absolutely not. So, even if you are concluding, if you, for example, you are finalizing your master degree, then you describe that. So what is important, however, is that by the moment you start in the program, by the moment that you register the program, that you should have finished your master degree. Even if sometimes you don't have received your degree diploma, that's not really a problem, but we will need a transcript from your university showing that you finalized your master degree. Otherwise, you will have a problem. So that's really important, but it's perfectly possible to apply with kind of a provisional status, saying like, well, my master degree is pending. Someone asked, is there a possibility of doing an online course from a home country? So I think it should be clear that we are a master program that emphasizes a lot the presence in class, that emphasizes a lot the interactions. So it's not an online program. This means that sometimes we are recording classes, but that's occasionally. So this is not a policy that we will record all classes. So I think that's important to realize. So we want to have people around, although we have people as well that are combining their different programs as well with other activities. I will say something about that in a second. So what does the future of bioethics hold? I think that's an interesting question. I think there is the interesting thing about bioethics is, I would say, there is not one specific track that is unique to everyone. What is really important is that we are a master of advanced studies, and I think that's really important in the sense that it's complementary to your first master degree. And what your first master degree will of course have a lot of impact on your place in the market. We see that a lot of people that have first studied medicine very often continue in their medical activities because they started medicine for their patients and they want to continue to care for patients, but they want to take as well some other tasks, being member of a research ethics committee, being able to participate in a clinical ethics committees, taking roles, for example, in a national bioethics committee, being able to take up responsibilities in their professional organizations, taking, for example, more advisory roles and developing policy and guidance documents at a professional level. Then you have people coming from other fields that might have, for example, more interested in going in teaching in bioethics. So I would say the different profiles I described beforehand are all possible, depending on your personal interest, personal motivation, and drive to go for a certain field. Is there a possibility of combining the master with a part-time job? And to what extent is that possible in Belgium or outside Belgium? So, of course, I think you should realize that the program is mainly designed as a one-year program to be followed in Leuven. But every year, approximately, I would say 20% of our students are part-time students. This means that they are following, spreading the program over 2 or 3 years. And that's perfectly possible. This means that you are selecting every year a number of courses that you want to follow. And as I have shown earlier, you have a kind of a selection of courses. You can see perfectly from July on, the schedule is available online. This means that from that moment on, you can start to plan your classes, your curriculum, and potentially organize your travel. We have had students coming from the Netherlands every week. We had a student 2 years ago coming from Portugal every week. Of course, this doesn't make this is an easy choice. And if you want to combine, I would rather argue try to have at least one full semester in Leuven. I think that would be a good plan with as many courses as possible. I think that gives you the most of the experience of being involved in a program. If you are working in Leuven or in Belgium, of course, it's much more easier to combine a part-time with the studies or studying part-time in combination with a full-time job. But of course, we are not designed for an online program, and I think that's important to realize. In my experiences, it's very often a kind of a discussion at the personal level about what's possible and what's not possible, and I'm very open to welcome any questions on that specifically that you might have, and I think it's useful to talk in that situation often with some part-time students, some people that have done it beforehand in that way, to see what's realistic and what's not realistic. So I'm very open to bring you into contact with some of our students or alumni that studied in a part-time fashion. Next question: how does this program practically prepare you for a career in clinical ethics? So, as I introduced you a little bit earlier, so we have a specific course now on clinical ethics that will be there from next academic year on. So this is a course in which we start with giving the practice, the basics of the relationship between healthcare professionals and patients, and where we will go into detail into with 4 clinical teachers, where we will discuss during seminars clinical cases. However, I would like to emphasize we are not a program in clinical ethics. I know there are internationally very well developed programs in clinical ethics where there is as well clinical rotations in the hospital, where there is a lot of time for mediation courses and so on. I don't think that's our strength in our program. We deal with that in a program. You will have a solid introduction into clinical ethics, but we have a program where there is not an internships in the hospital. So I would like to clearly position that perspective so that you know that you don't have wrong expectations at that level. I have here a question from someone interested in engineering ethics. So that person would like to know a little bit more about the relationship between engineering ethics and bioethics. Of course, I think it's important to realize that a lot of the ethical issues that we discuss in relationship with bioethics is linked to development at the technological level. So this means that a lot of the technology that develops is, of course, very much influenced by engineering. And just giving the example of a course that we have is the course on the ethics of human genetics. We have seen in the last 10 years a tremendous technological development, and the technology has generated quite a lot of questions. And so this means that we are much more going into the implication of certain technologies, but of course we will as well, in an indirect way, touch about how you design technology, and that offering a technology is not value neutral, and that there are already some choices embedded when designing a certain technology. And so in that sense, engineering ethics is, in my view, very much linked to bioethics, but like as well, neuroethics, for example, is as well integrally part of bioethics. Next question: how do the skills and knowledge gained from this program transfer internationally? I think that's an important point. We designed the program as an international program, and this means that in a lot of the issues that we are touching are really touched from an international perspective. And I would like to give the example, for example, of medical law course that we have. It would, of course, not be possible to give only a course where it's focused on the national Belgian legislation. So we are taking a much more international perspective, where we take a more comparative perspective, where we try to as well integrate kind of internationally regulatory frameworks that have an impact on the framing of new technological development and the ethical issues related to that. As well, I would say a lot of the discussions around new technologies, or a lot of the topics that we discuss, are internationally focused. We are using a lot of the international literature, but of course we are, and that's the kind of the balance. Of course we are influenced by as well our national context and a European context, and I can give you the example in the course of foundations, for example. We'll talk about a concept as solidarity, which is in a European context a very important concept if you think about organization of healthcare systems, reimbursement of health costs, and the tensions that it gives at this moment. So if you think about the selections of topics, of course we are as well, I would say, biased by the context in which we work. Having a course of ethics of human genetics, for example, and a lot of the topics we discuss there, think about discussions of developments like the use of genetics in reproductive technologies, like pre-implantation genetic diagnosis. of course, we are somewhat influenced by the fact that these are discussions, dilemmas that exist in our context. And I realize that in some countries, for example, the technology is not available. Doesn't mean it will not be available in 10 years from now. But of course, although we are very much, I would say, focused on international developments, this doesn't mean that every discussion will always be as relevant or as important in every country. But I think the skills that you get in dealing with such questions, and I would say a lot of the cases we discuss, I think it's not only about the case, it's about are you able to transfer the knowledge and the skills to other situations in the future. And I think that's important, and the more topics like that you discuss, the more you are prepared to deal with those topics in other contexts. So next question, how competitive is the application process? What makes a compelling applicant? So I would say it's when you look at an application, we will look first of all, is your application at the formal level okay? This means, do you fulfill the basic criteria? Do you have a master degree or equivalent? Do you have sufficient language skills? And these will be the most important elements. And then the next question is the evaluation, like, well, are you a good match and a good fit in our program? To what extent do you think that from your background, you will be a good addition to the program? To what extent do you have an interest in our program? And we're making an evaluation on that. Is it a competitive application process? If you make a good, a competitive application, a well-prepared application, I think you have a good chance of being accepted in the program. So what we want is to have a motivated applicant interested to study bioethics and is able to motivate that in a good way. And what we look at as well, will that person be able to finally to graduate in our program? So that's an important element. So this means that, for example, if it shows from your application that you wouldn't be able to write a good motivation letter, well, you might not likely be able to write a good dissertation, and therefore you will not be, of course, not be accepted to the program. Of course, what is a little bit more tight is the competition for a fellowship. We can only accept a limited number of fellowships every year. Of course, the competition is somewhat more difficult. So I think, as far as I can see, I don't have more questions until now. So with this, I would like to then end this session. I hope it was instructive to all of you. I hope I motivated all of you to come to Leuven to study in our Master of Bioethics program in Leuven. I would like to invite you to contact me or our staff if you have any further question. And I look forward to meet you here in Leuven in our Master of Bioethics program. Thank you very much, and thanks for watching, and please consult our website for more information. Thank you.